Welcome back to All Things Autism by Court One. I'm Anisha Ravel. In our last episode, we discussed common misconceptions about autism. Today, we'll explore the wide range of experiences within the autism spectrum and how it presents uniquely in different individuals.
Thanks, Anisha. I'm Manav Raval, another one of your hosts. Autism spectrum disorder represents a broad spectrum of behaviors, strengths, and challenges. This diversity means that each individual on the spectrum experiences it in their own unique way.
Exactly. I'm Shashir, another host. Our goal today is to highlight this variability, from individuals who may need minimal support to those who require more intensive assistance. Later, we'll hear from Hamna Tayyab, a board-certified behavioral analyst with a focus on delivering ABA therapy to deepen our understanding.
A term often heard is high-functioning autism, which refers to individuals who can perform daily tasks with fewer supports. However, this does not imply the absence of challenges.
Right. Individuals considered high functioning may excel in certain areas, but still face difficulties in aspects like social interaction or sensory processing.
On the other hand, some individuals might have significant communication challenges and require more assistance in everyday activities. It's important to recognize that each person's experience is valid and deserves respect.
This spectrum's breadth is vital to understanding how autism can affect people differently. Let's delve into specific examples to illustrate this point further. For instance, some individuals with autism might develop an intense focus on certain topics, which can lead to impressive expertise in those areas.
Others may experience heightened sensitivity to sensory inputs, making environments with bright lights or loud noises overwhelming.
Meanwhile, some might develop effective coping strategies for their challenges, while others need more support to manage their day-to-day lives. These differences extend to behavior as well. Some individuals may experience emotional outbursts, often as a response to frustration or sensory overload, and not as a sign of anger or aggression.
For instance, behaviors can become more challenging over time, particularly if they struggle to communicate their needs effectively. And this can actually lead to frustration.
It's important to approach these situations with empathy and seek early intervention, which can greatly help in managing these challenges.
We'll now turn to Hamna Tayyab, the clinical director of advanced behavioral specialists in California, to provide her perspective on these progressive behaviors and the role of early support. Hamna, thank you for joining us. Could you share your thoughts on the variability within the autism spectrum, particularly in early childhood?
Hi, thank you guys so much for having me. I'm happy to be here. Definitely would love to share that. So autism is on a spectrum, which means that no two individuals with autism will exhibit the same characteristics. And there are two main areas that we look at based on the DSM-5, which is the diagnostic manual. And those are social communication and restricted patterns of behavior. And within early childhood, there are a lot of factors at play. Autism can be diagnosed as early as 2 years of age. However, I always say it's a good idea to retest in about 2 to 3 years' time. And this could be because sometimes there are characteristics of autism that can present themselves, but this child might just have some delays in meeting milestones. So, super important to kind of mention that. Some children, they present with skill deficits. Others present with performance deficits, which is basically they have the skill, but they're not utilizing it enough or not utilizing it in all of the settings that they need to. And some are presenting with unsafe behaviors. Or you have a child that presents with all of these things. They have the skill deficits, the performance deficit, and the unsafe behaviors. Some areas that you might see variability. So there's variability in communication skills. Some children are non-vocal, which means they don't speak vocally. Others have developed vocal language and then go on to regress later on in life. I've talked to parents where, up until the age of like 2, their child had words and then all of a sudden completely stopped, right? And were non-vocal. So we have seen things like that happen as well. There can be variability in severity and intensity of behaviors. There's variability with social interaction. So some children may struggle with attending and interacting with peers. Some are struggling with initiating and maintaining conversations. Some struggle with understanding social cues. there's variability in like stereotypic behaviors, so which is repetitive patterns of behavior. These can be vocally repetitive behaviors, motor repetitive behaviors. And so really when you're looking at a child with autism, they can have all of these things kind of going on with them. They can have some of them. So, that can kind of speak to the variability that you would see with a child that has been diagnosed with autism.
Yeah, so those are some really good ideas, Hamna. Studies have shown that no two people share the same experience. And I agree that it's important that we don't generalize those on the spectrum into a singular category. Also, I really appreciated how you mentioned the variability within diagnosis as well. So thank you so much for that.
Can you explain how early intervention can influence the developmental trajectory of children on the spectrum?
Yeah, so early intervention is super important. Starting early is very, very important. Early intervention can make such an impactful change for children on the spectrum and also for their families. So when we're talking about early intervention, that can look like a lot of different therapies kind of mixed in together. ABA therapy is one of them, which is what we provide here at our clinic. You can also have speech therapy, occupational therapy. Those are just a few to name. There's also physical therapy that can be involved. And so if started early on, we can significantly improve the quality of life of the children that we're working with when they have these interventions in place. There's a term that we use, it's called history of consequences. And basically what this means is, in simple terms, that the environment around us, our interactions with people and our everyday events are basically shaping our behaviors. So for example, let's say if we have a child that is non-vocal, and does not have an effective communication repertoire. And let's say that their current form of communication is through tantruming or yelling or crying, right? And this usually gains them access to the item that they're looking for. So it's basically their way of communicating, because first and foremost, behavior is a form of communication. And so what ends up happening is this becomes a history of consequence for them, right? They know reliably, I tantrum, my needs are met. I tantrum, my needs are met. And so the longer that this goes on, the more resistant to change that behavior becomes, right? And that's not to say that it won't help if we do it later on. But let's say if we start a child on ABA therapy and speech therapy at the age of 2, right? And we're teaching them to use effective communication. It comes with less resistance, still challenging, but comes with less resistance than, let's say, we were starting these therapies and interventions for the first time with an 8-year-old child who has not been taught any, has not had any formal like therapies and things like that. And we're trying to teach them how to communicate for the first time. And again, not to say that it's not possible or that the interventions won't work. It just, may come with more resistance. So all of that to say, starting early can make a huge difference.
Yeah, indeed. Individualized support is key. And I really liked how you mentioned how behavior is a form of communication. And that's an excellent point. And the right support tailored to each child's unique needs can actually lead to those significant improvements in their quality of life, which is essential to their upbringing. Okay, so next.
What role do family and community support play in the development of children with autism?
A really great question. And I think it's a really family support is vital. We can do all the interventions in the world, right? We can provide them with 4 or 5 hours of therapies every day and put in all these goals and interventions. But if there is no family support and buy-in, it will not be successful. A great example of this is here at our clinic. So we have children that are coming to us for 4 to 8 hours a day, depending on the level of need that they have and the hours that they're here for. And so where they're coming here, we're working with them. Parents drop off their kids, so the parents are not here during the main therapy time. And so we're placing all these interventions and we're doing all these things, but a part of our program is parent training. So we conduct parent education meetings, and these are on an ongoing basis so that we can make sure that the interventions that we are implementing here are being implemented in the home, in the school, when they're out in the community. It kind of needs to be done everywhere. And if we don't do this, there's this thing that happens where behaviors will continue to happen and there's minimal changes. So we can do everything we're doing here, but if it's not being followed through and the support is not there from everybody in the family unit, and that includes like parents, grandparents, aunts, uncles, cousins, everybody, right? And if we're not having that consistency, what you'll kind of see happen is there will not be a lot of change. You will see minimal improvement, and the behaviors will continue to occur. Or you can also see that in some areas, so for example, at the clinic, the behaviors will pretty much be gone, but they will increase times two in the home setting. And so in order to kind of avoid this, we really want to make sure that everybody is on the same page. And so we do this with kind of talking to parents beforehand, like, hey, these are the interventions that we want to implement. But before we're able to do that, we need 100% buy-in, right? Are you ready to do these things that we need you to do to kind of make sure everything is being followed through? So we have a lot of those conversations. There's a lot of, preparation involved to get to that point. And we really do try to meet the parents where they are at, right? Like if whatever you're able to commit to, if you can commit to 10 minutes a day of learning what we need you to do, we'll take it, right? So yeah, super important to have that support.
Yeah, of course. Strong support systems really can make a big difference. A study in the Journal of Autism and Developmental Disorders actually found that family support can significantly enhance the overall well-being of children with autism. So it's really important to keep families informed and an essential part in the intervention process. So going along with environment and lifestyle, what role does routine play in the behavior of children on the spectrum, and how can inconsistency in routines lead to behavioral challenges?
Another great question. Routines are so important for everyone, right? For adults, for neurotypical children, everybody needs routine, right? Or else there would be chaos. So it's not just, for children that have autism. Everybody needs routine, but now with someone that has autism, they have an even higher need for consistency and routine. And this can also help mitigate some of those behaviors, right? When you have clear expectations, you know what your day looks like, that can help reduce some of the behaviors that a child with autism might display. At the same time, one of the possible characteristics of autism is inflexibility and resistance to change. So with this, changes in routine can trigger behaviors. So we kind of have to do this sort of balancing act, right? Where we want routines and consistency, but at the same time, we need to ensure that small disruptions in your day, which is bound to happen, right? And sometimes cannot be avoided, that those disruptions are tolerated. So what we do with ABA therapy is we work with children, we implement interventions that are kind of teaching them to emotionally regulate themselves when disruptions occur. So we try to find that balance of, yes, you need routine and structure, but also at the same time, we also need to teach you how to be okay if that routine or structure is, disrupted in some way. When it comes to the consistency with therapies, such as attending your ABA sessions or speech sessions or parent education sessions, or even attending school, right? Those are kind of the main areas where you would want to see consistency. You want to keep those appointments, limit cancellations, limit being late, because we want to continue to build and strengthen the foundation that we're working on.
That's a great point. And routine is essential to preventing sensory overload as well. And with this routine, we can have a more organized and more influential lifestyle at whether some do have autism or some may not. So that's an incredibly important point.
Yeah, so thank you for that. Moving on, how can educators and caregivers adapt their approaches to accommodate the diverse needs of children on the spectrum?
Good question. I always say, we always want to approach from a compassionate and understanding point of view, right? What I see and hear quite often from parents is they're typically comparing their autistic child with their neurotypical children, right? And if, for example, their neurotypical child can brush their teeth without needing a reward, why can't my child with autism do the same? So I tend to get those type of like questions when we're going in and we're, implementing goals and strategies and these interventions. Those are some of the kind of things that the pushback that we'll see, or if this student who has the same diagnosis can sit at their desk and do their work, why does it matter? Why does this other student need to take a break every 15 minutes, right? And so that's kind of because I have experience both in home and also in school. So that's kind of what we would see, right? Like, why can't both these children do the same exact thing? And my answer to them would always be, every child is different, and we have to meet them where they are at, right? So for example, with the rewards, it's not forever, right? This is a tool to help get your child to where they need to be. It's not going to be an entire for the rest of their lives that like they have to get a reward to do this task, right? And we try to kind of explain the science behind what it is that we're doing. And same thing with, in the school setting, this is not forever, right? They won't need a break every 15 minutes forever. But in order to get them to where you want them to be, which is sit down and complete an activity without having to get up, in order for us to do that, they first need to build up to where they need to go. So it goes back to, individualized accommodations for every child, and that we can't fit every child with autism into one box because they will not fit there. Everybody is different. Everybody has different needs and different accommodations. And so we always want to start there and see what is the ultimate goal and where are they right now? How do we get them to that goal, right? And that journey will look different for everybody.
Exactly. Adapting those educational strategies, that is very important. And with these, the use of visual supports and structured routines can be particularly beneficial, as suggested by many educators and autism specialists. And I like how you framed it as a temporary process that does not last forever, and especially how you highlighted individual needs, as everyone on the spectrum is different.
So, for our next question, are there specific strategies or tools that you recommend for managing sensory sensitivities in young children with autism?
Yeah, so when it comes to, sensory sensitivities, I think the first thing we always want to do is rule out any medical reasons. So medical reasons aside from, being diagnosed with autism, right? You want to make sure that there's nothing medical that's causing it that could, let's say if it's something related to noise, right? We want to make sure there's nothing going on with your ears. If it's related to like lights, we want to make sure, with your eyes, everything is okay. So we first always want to rule out anything medical for these sensory sensitivities. If there is nothing medical that is causing this, we then want to identify the triggers, right? What is causing the sensory sensitivities? Whether is it something behavioral, is it environmental? So you always want to start off by knowing why this is happening, and that always gives you the best approach. And so once we know why it's happening, then we can focus on creating a sensory environment that is comfortable, right? And so there's a lot of different things that you can do by, for example, reducing noise, right? Headphones is a good example for this, or like the noise canceling or headphones would be a good option. Adjusting the lighting, creating calm spaces for de-escalation, utilizing sensory supports. This could look like a weighted blanket, fidgets, a weighted vest. Some kids like trampolines or kinetic sand, Play-Doh. We also work on sensory desensitization, right? By incorporating sensory play activities. So if I have a child that has a lot of sensitivities with like textures, I might introduce them to sensory play where we're kind of working on desensitizing them in a, compassionate, trauma-informed manner. Occupational therapy is also a great way to work on sensory-related concerns as well. So ABA does do a lot of collaboration with occupational therapists to kind of work on those goals. But I think it always just starts off with you kind of have to know why it's happening, or else it's a guessing game. And so for a child that's receiving ABA therapy, we would be the ones to kind of figure out what is causing those sensory sensitivities and provide those answers to parents. If you don't have access to ABA therapy, or don't have access to kind of those supports, I would just say, get to know your child, see when the triggers are happening, see what are some of the things that are causing them, and that can really help figure out, different things that you can try to kind of help with those sensitivities.
Exactly. And sensory-friendly environments and tools like those noise-canceling headphones or those weighted blankets that you mentioned, those can provide relief and comfort, aiding in a better sensory management environment. And Desensitization and occupational therapy in its sensitive way is a really great way to overcome sensory sensitivities progressively. I really liked that you highlighted the importance of creating a comfortable environment. So, going along with that, how can providing a sensory friendly environment impact behavior, particularly in school or home settings?
I think providing sensory safe environments will kind of help can help mitigate behavior. So you'll kind of see like in the school settings, they most classrooms will have some sort of like quiet corner or like calming corner, and that can kind of help a child de-escalate. And so speaking from a school setting perspective, you have a child that's overstimulated for one reason or another. There's a lot of, and if we're talking about like a special day class setting, right, you have probably like 10, 12 other kids in there who also have, they might be engaging in some sort of sensory behavior. So it's creating this, and you have like aides in the classroom, you have teachers in the classroom. So it's a very, crowded, loud environment. And if you're trying to de-escalate a child in that situation, it can create a lot of, pushback in that area. So really having a calm corner, an area where that you can kind of just let them go and like let them calm down. It's a safe area, right? That can really help to kind of like help reduce those behaviors and bring the self-regulation on a lot quicker. Here at the clinic, we have sensory areas for all of our kids, and we have like a padded area where they can kind of like like sit there and relax and kind of de-escalate without us having to take a hands-on approach, right? Our goal is always to be as hands-off as possible. So we do that. We have a trampoline. We have a whole like sensory area set up. So what you really want to do is allow access to those sensory activities non-contingently. And what that means is you don't have to do anything to earn this, right? We're just going to fill your day with all of these sensory activities so that it can help regulate you throughout the day.
Yeah, thank you for that. The sensory designated areas that you mentioned could surely really be successful. So in regards to families trying to navigate support systems for their children, what challenges do you see in these groups and demographics, and how could these systems be improved?
That's a good question. Also, a hard one to give a really good answer on because there are so many challenges and behaviors. Unfortunately, my area of expertise is mostly with insurance-based therapy, so I can, probably speak a little bit more on that. There's differences, state by state, things differ. Here in California, I think, we do get a little bit, it's not as challenging as it would be in other states, I would say. But still, nonetheless, it is challenging. So I would always say that parents really have to advocate. You know your child best, right? And if somebody is not listening to you, you have to advocate for your child. Joining support groups, making connections, calling the insurance companies, right? As many times as you have to, if that's what you need to do to get the services for your child. If there's a process that they want you to follow, follow it. And, it's probably not a super hopeful answer, but, it's an unfortunate reality of all the barriers that you will kind of see as you're navigating these systems. Navigating school supports, you really have to get educated on special education laws, both federal and state level, and you have to know your child's rights. I've been in countless IEP meetings where they do not like me because I go in there and I'm like, you have to do this, this, and this, because a lot of the times parents are not informed on what their rights are, and they kind of just slip through the cracks, right? And so IEP meetings can be intimidating. So you really want to go in well prepared. Hire an advocate, hire a lawyer if necessary, to be able to kind of guide you through that process because it can be a really scary one and a really intimidating one, especially if you don't have those supports in place. On how to kind of improve the system, I don't think there's really a complete answer that I can provide. Last year I attended a conference. It's called the Autism Law Summit. And it's a great resource to learn about current laws and legislations regarding autism and similar supports. Also a great place to make connections with people who are basically dedicating their lives to advocate and like improve these systems that we're talking about. So I always recommend looking into that, joining that summit. It was actually started by parents that had a child with autism that was not getting any services, and they were, both lawyers. So, they kind of fought for their child and turned it into this whole conference that happens every year. So, really, really great story. So I would really recommend checking that out, building connections, and you kind of have to know the right people to be able to help guide you in what you need to do. So that's what I would recommend.
No, it's an awesome recommendation, and navigating these systems can definitely be really daunting. I think increased accessibility and streamlined services are often recommended to ease this process for families as well. So I think those were all great recommendations.
Exactly. And another question would be from a developmental standpoint, how does the transition from early childhood to school age children affect those children on the spectrum? And what can schools do to support that transition specifically?
Yeah, so transitions are super hard. You have new settings, new people, new routines. There's new skills to learn. And if you're on the spectrum and you have skill deficits and you're working on skill deficits in one area, and now you're developmentally in a different age in a different area, and you have all these skills that you need to learn. So it can be really, really challenging. I think this is where consistency is very important. Having a plan in place, right? Knowing your child's triggers and knowing how to properly respond to them can help make this transition a lot easier. And here at our clinic, I like to call it a school readiness program that is embedded with the principles of ABA. So we have things that are kind of set up to mimic a school-based environment, and we work on routines and schedules and following rules and pre-attending and pre-academic skills. And what we're doing is we're trying to prepare young children for the school environment. But not all children have access to these type of programs, and so daycares, preschool, kindergarten, those are all really good options to teach your kids school readiness, so that they are prepared for that transition. And educators can also help by creating a collaborative environment, right? Where everybody that's involved in that IEP team is involved, like they're collaborating together, and following the IEP accommodations that are outlined for that child. So I think really going back to that, like this, everything is individualized. This child has accommodations and goals. Let's focus on that. I think that would be very helpful.
Yeah, smoothest transitions are really essential, and collaboration between families, early childhood programs, and schools can really help children adjust and thrive in new environments.
However, when a smooth transition is not achieved, it's important to understand emotional and physical difficulties. So, how do behaviors like meltdowns or physical aggression relate to sensory overload, and how can caregivers differentiate between the two?
That's a great question. So behaviors such as meltdowns and physical aggression, they can have multiple functions, not just, sensory overload. However, I do believe that sensory overload always plays a role in behaviors. And as I had mentioned before, behaviors are a form of communication, and with behaviors such as aggression or meltdowns, there is a component of dysregulation that can lead to sensory overload. So all that to say, the behavior might be occurring because they are, for example, trying to escape a task, right? But they are escaping that task because they are overstimulated, which dysregulates them, which causes sensory overload. So it kind of all plays a part together at all times. The best way to be able to kind of differentiate between this is you want to get specialized help for your child, right? So ABA is a great resource, and for ABA is a great resource, and we're always including parent education within our program. So within ABA, the clinician on your team, which is the BCBA, they'll conduct an assessment, and they basically will pinpoint behaviors and their functions and create a treatment plan that basically outlines why the behaviors are occurring, how to set up the environment for success, and also how to respond to these behaviors. So you'll get a whole picture of the meltdown is happening because of this, and this reason. It happens when these things occur in the environment. This is how it's currently being responded to. This is how we want to respond to it. So you get a whole like treatment plan. It's called the behavior support plan. You can call that as well. That's what they have in schools. And so that can really help you to figure out what's going on. And so if not, then you're just playing a guessing game, right? There's so many possible options of how you can respond to a behavior, how you can set up the environment. But if you don't have those answers pinpointed, you're playing a guessing game. And along that way, that can actually make the behaviors further strengthen, which then again causes there to be a higher resistance to change.
Hamna, thank you for your valuable insights. Understanding the spectrum's variability is so crucial in offering appropriate support and fostering empathy.
Yes. And for our listeners, recognizing these differences can help create a more inclusive and supportive environment for those on the spectrum.
We will continue to explore more aspects of autism in future episodes. So, thank you for tuning in to All Things Autism.
Remember to follow Court 1 for more updates and resources. Until next time, take care.